Should a patient ever have pain inside the chamber? And if a patient ever has pain inside the chamber, what would we do about it? The fast answer is no. A patient should never have pain in the chamber. If you are that patient having pain, or if you're the doctor or technician and you're putting a patient in the chamber and they're having an issue, they're having some sort of pain, that is an absolute signal that something is not going well in that moment. And it is our job to do something right away if that ever happens. The most common type of injury inside of a chamber is middle ear barotrauma. And when that happens, it's almost always a result of us not coaching a patient on all the different ways to clear their ears, whether it's to yawn or to swallow, chew gum and swallow, sip some water while they're in the chamber, the Valsalva, pinch your nose and blow, which will force your ears to pop. It is our responsibility to coach patients to understanding how to handle the pressure changes, especially during the first 5 or 10 minutes of their session, when the pressurization process is occurring and pressure is building inside that chamber. I hope you find the content of this channel really helpful, either for yourself, for your clinic, or for a loved one. Please don't forget to share it with somebody if you think it might help them. It's our mission to get as much of this information out into the public as possible to make sure that everybody has access to hyperbaric oxygen who needs it. Please hit the subscribe button. Please make sure you hit the like button, and absolutely feel free to ask questions. Those are the questions that I'm often answering when I do these sessions. On our intake forms, we have multiple questions about how aware people are of pressure changes, how well they handle those pressure changes, whether they've scuba dived or not, whether they have issues on airplanes or if they feel it in elevators. You'd be surprised. It's not a huge percentage of the population, but if you're one of those people and you've been in a chamber having pain in your ear and you don't know what to do and nobody ever brought that up, the likelihood that you get nervous and have an issue and now don't know how to clear and can get injured is possible. And so it's really important that we take the time to really coach our people so that they understand exactly how to handle pressure, exactly what to do if that's occurring. And as a technician or the doctor running the chamber, the first thing you would ever do if a patient had a problem is stop the chamber travel immediately. So we use hand signals. So just like scuba, something's wrong with my ear. We teach patients, if you're having an issue clearing, you're not able to clear your ears, you say to us, something's wrong with my ear. We know exactly what to do and we can help you. And the first thing we do to help somebody is immediately keep the pressure exactly the same inside that chamber. Don't bring the chamber up. Don't let the chamber keep going down. Stop the travel, assess the issue, and then make some decisions. Many times, if you just stop the travel and give the patient a little bit of time, they'll be able to equalize. If for some reason they're not, you can bring that chamber back up a little bit, and that will often help them equalize the pressure as well. Or in some cases, it just means this isn't the right day. Maybe we have allergies or some other issue that's inhibiting the body's ability to clear your ears, in which case today's not your day. We're going to bring you back up to the surface. Your session is over and we'll try again on a different day. Again, number one, patients should never have pain inside the chamber. Any pain inside the chamber means that you have to stop the travel of that chamber immediately, assess the issue, and go from there. There are plenty of other things that could happen inside of a chamber. I'm only covering middle ear barotrauma because it's the most common. If dealing with issues inside the chamber is of interest to you guys, please let us know in the comments. Please ask a few questions. And if there is that interest, I will absolutely answer other questions about different situations that arise inside the hyperbaric chamber. Okay? Hope that helps. See you next time.